Hi, my name is Garrett Candelaria. I'm a second year medical student, and over the summer I was able to work with Centro, Nueva Creacion, home of the Goodlands. My academic preceptor was Dr. Goldstein, a pediatrician at St. Christopher's Hospital in Philadelphia, and my community preceptor was Maribel Arzuaga, who is the executive director at Centro. Centro Nueva Creacion is a nonprofit organization that operates an after school program and a summer camp for elementary school students in the Fairhill neighborhood of Philadelphia. Fairhill is one of the poorest neighborhoods in Philadelphia, with 61% of the population living below the poverty line. It is also one of the least educated neighborhoods in Philadelphia, as more than 50% of children do not go on to graduate high school. The mission of Centro is to promote resiliency within the young people of Fairhill and engage them with educational enrichment and within the Latino culture. Fairhill is actually one of the highest density locations in the United States of Latinos. Centro primarily achieves its goal by utilizing project based learning, PBL, to engage children in arts and Latino culture. And over the school year, as an after school program, Centro offers homework help and tutoring to students. And over the summer, it hosts a summer camp that covers sciences and arts. Over the summer, I worked with the Goodlands Summer Camp that Centro holds annually for the Fairhill youth. Due to the ongoing COVID-19 pandemic, the camp had to be held virtually this year. This presented a real challenge in terms of developing a lesson plan that was still going to be engaging and beneficial for elementary age students, but also could be that could be held virtually. And I was tasked with teaching primarily sciences and health-based lessons over the summer. And the way that I did this was holding 45-minute sessions a week, working with groups of kids aged between 7 and 11. Some of the topics that we were able to cover over the summer included states of matter, paleontology, solar system, and cardiovascular health. Within these lesson plans, I tried to incorporate activities to keep the kids engaged. So some of the things that we did were make slime, practice different exercises, do scavenger hunts, and play various games during the lessons. Unfortunately, due to the pandemic, the attendance this year was dramatically reduced compared to previous years. And so sometimes there would be 4 kids in my lesson plans, and sometimes there would only be 1. And so it was really difficult to try to work one-on-one with a 7-year-olds essentially and try to teach them science. As a lot I had really planned for a higher attendance, so it was a lot of adaptation that I had to incorporate into my lessons. So these are some of the images of slides that I incorporated into the lessons over the year. So on the solar system slide there, I used Prezi, which allowed me to make it more interactive and fun for the kids. And so when I move on to a next slide, it zooms into the sun or one of the planets to give more information and make it more of like traveling through space experience. With the dinosaurs, I tried to incorporate oral health and teach them how to brush their teeth. You can see the picture of a dentist looking at a T-Rex's teeth there. And then with the heart health, we did a bunch of exercises during it, so we were up and about moving. So it was really fun working with the kids over the year. The coronavirus really left the feral community and Centro in a really difficult position, and it made the disparities between other neighborhoods really evident, and that was really seen in the decrease in attendance at the camp. Just if kids don't really have access to a computer or internet, virtual education isn't even a possibility. And so with the coming school year, with a lot of schools moving to a hybrid lesson, I worry about a lot of kids not being able to access a computer or access internet, and kids not receiving quality education as compared to other wealthier neighborhoods. And a return to in-person instruction doesn't really fix this issue either. Just increasing the kids' exposure to COVID and risk of getting infected leaves that population really vulnerable, as a lot of them are on Medicaid or don't have insurance, and so really just a lack of health care in general leaves them really vulnerable to the pandemic. And it's just been really eye-opening working with Centro and working with the youth, just seeing how much the pandemic has really affected them, even though they put their best efforts in to adapt their program to a virtual format. You can really see just how much gaps still exist and how many kids continue to fall through them.